Thank you for choosing Westmead Fertility Centre, a wholly owned subsidiary of the University of Sydney. The Westmead Fertility Centre team includes highly skilled embryologists, experienced nurses and counsellors, and helpful patient support staff who work alongside our leading fertility specialists, so you can rest assured you will be in safe hands with our expert team. This video will tell you what you need to know before you embark on your treatment with us. We understand you will have a lot of questions as you move through your treatment, and our team will always be here to guide you through and give you the information that you need. The best way to contact us is by logging into your patient portal at www.westmeadfertilitycentre.com.au. Your patient portal also contains important information about the status of your pre-treatment requirements. This means you have 24/7 access to your personal information, so you can ensure that all your requirements are current and valid for any intended upcoming treatment. After we have registered you as a patient and you have verified your email address with us, registration details for the portal will be emailed to you before you start treatment. If you don't receive the registration email, please give us a call and we will get it sorted out for you. The registration email will also contain a link to an instructional video showing you how to navigate around the portal. Each time you need to contact us to either give us some information or to ask us a question, log your query on your patient portal and one of our dedicated team members will get back in contact with you as soon as possible. Please also follow this process to let us know it is day 1 of your cycle, and one of our nursing team will contact you to get your treatment started. You can also reach us via email. Please use your last name as the first word in the subject line and send your email to wfc.reply@sydney.edu.au. Or text. Please include your last name as the first word in the message and send your text message to 0427 841 998. Please note that failure to include your last name in this way may delay or prevent your message from reaching us. There may be times when your query is more urgent, so if during your treatment you have concerns about your medication, are experiencing increasing pain, nausea, vomiting or shortness of breath after egg collection, or bleeding and pain in early pregnancy, call us directly on 02 8890 7484 so we can assist you immediately. If these symptoms arise outside of our business hours, call Westmead Hospital on 8890 5555 and request contact with Westmead Fertility Centre's on-call consultant. Of course, if it is a medical emergency, present to your nearest emergency department or call 000. Once you are registered as a patient with us, you will receive an email containing a PDF of your unique patient identification card. Please print or save the PDF image attached to your smart device to scan through our patient check-in stations at each visit. This will alert our team of your arrival at the clinic. So after you have scanned your card, please take a seat and our staff will attend to you as soon as possible. The patient self-check-in station is located just as you enter the clinic. Please also remember to check out as you depart. Westmead Fertility Centre is proud to partner with New South Wales Health and is committed to offering affordable pricing and broad access to quality fertility treatment. You will not require private health insurance to access services at our clinic. Unlike many other fertility services, our clinic offers all-inclusive pricing for treatment, including all costs for your cycle, theatre and anaesthetic fees, as well as freezing and complimentary storage of embryos for up to 3 months. If you are eligible for Medicare support for your treatment, it is important that you have a valid GP referral to one of our fertility specialists. This must be valid and dated on or prior to day 1 of your cycle. To ensure you receive all possible Medicare rebates, and therefore the lowest out-of-pocket costs, prior to commencing treatment you should check with Medicare that you and your family are correctly linked in their systems. This will maximise your entitlements under the extended Medicare safety net. If you are not eligible for Medicare, please talk to one of our team for more information. From a Medicare point of view, a cycle starts on the first day of your menstrual cycle, or as soon as you start taking stimulation drugs, and continues through to the embryo transfer. Your fertility specialist will work with our team of nurses and embryologists to determine the best course of treatment for your own circumstances. Sometimes, to ensure patient safety and the best possible outcome, a cycle may end before embryo transfer. There are various reasons for this, and should this happen to you, our team will explain the specific clinical reasons applicable. This may result in the cycle being considered cancelled, in which case most of your fee will be refunded to you by our clinic.
Sometimes, the best course to maximise your chance of success is not known until your eggs and sperm are collected. This may result in a change in the method of fertilisation from in vitro fertilisation, IVF, to intracytoplasmic sperm injection, ICSI, where the sperm are injected into the egg. ICSI involves more of our embryologist's time,
and an additional charge will be payable. Some cycles will have the best possible outcome if all embryos are frozen before transfer. In this case, there is no fresh embryo transfer, and all embryos will be available for a subsequent frozen embryo transfer cycle, known as an FET cycle.
FET cycle costs are not included in the upfront IVF ICSI cycle fee and involve the start of a new cycle that ends when the frozen embryo is transferred.
If you reside in regional New South Wales, being more than 100 kilometres from our clinic, please ask us for information on how we can support you by providing more of your treatment closer to home. Our clinic is committed to improving access to fertility treatment by keeping our fees as low as possible. For Medicare eligible patients, we do this by charging the bulk of your fee directly to Medicare, and you are only required to make the gap payment to get your treatment started. After you have logged your day one on your patient portal, our administration team will email you an invoice that will detail our available online payment methods and the amount that you are required to pay, noting that payment of the invoice is due by day 5 of your cycle. It is important to note that the final out-of-pocket cost quoted to you presumes that all ultrasound and blood testing is conducted within the facilities of our clinic, or for our regional patients, conducted by a pre-approved WFC provider. Any blood tests or ultrasound scans that you choose not to have done at these locations cannot be bulk billed, and you will incur costs for these tests in addition to the out-of-pocket costs quoted by our team. Your fertility specialist will provide you with the prescriptions you need for your treatment. If you are planning to start a cycle and don't have a script for the required medications, please contact your fertility specialist directly. You will need to purchase prescription medication for your treatment, most of which are available on the Pharmaceutical Benefits Scheme and are available to you at a subsidised rate. These medications are available from Macbeath's Pharmacy, located within Westmead Hospital. But if you are planning on using a different pharmacy, please advise them in advance of your cycle start to allow time for them to stock the medications that you require. To summarise, please ensure that you A. Verify your email address so that we can register you for communication via the patient portal. B. Contact Medicare to ensure all family members are linked so you may maximise your entitlements under the extended Medicare safety net. C. Check your GP referral is valid and is dated on or prior to day 1 of your menstrual cycle. D. Ensure you have prescriptions from your fertility specialist for all medication required for your treatment. Remember, our team at Westmead Fertility Centre is here to answer any questions or address any concerns you may have before, during and after your treatment. So please contact us through your patient portal on our website, and one of our team of experts will contact you to provide assistance as soon as possible. We thank you for choosing Westmead Fertility Centre, and we wish you every success with your treatment.